Suprarenal gland and ChromaHin system. Introduction. The suprarenal or adrenal glands are endocrine glands which help to maintain water and electrolyte balance. These also prepare the body for any emergency. These are subjected to hyper or hypofunctioning. Lack of secretion of the cortical part leads to Addison's disease. Excessive secretion causes retention of salts and fluids. Tumour of adrenal medulla or pheochromocytoma causes persistent severe hypertension. Superarenal gland, dissection. Locate the suprarenal glands situated along the upper pole and medial border of the two kidneys. Identify the structures related to the right and left suprarenal glands. Subdivisions. The suprarenal glands are a pair of important endocrine glands situated on the posterior abdominal wall over the upper pole of the kidneys behind the peritoneum. They are made up of two parts. 1. An outer cortex of mesodermal origin, which secretes a number of steroid hormones. 2. An inner medulla of neural crest origin, which is made up of ChromaHin cells and secretes adrenaline and noradrenaline or catecholamines. Location. Each gland lies in the epigastrium, at the upper pole of the kidney, in front of the crus of the diaphragm, opposite the vertebral end of the 11th intercostal space and the 12th rib. Size, shape, and weight. Each gland measures 50 mm in height, 30 mm in breadth and 10 mm in thickness. It is approximately 1/3 of the size of kidney at birth and about 1/30th of it in adults. It weighs about 5 g, the medulla forming 1/10 of the gland. Right suprarenal is triangular or pyramidal in shape and the left is semilunar in shape. Sheaths. The suprarenal glands are immediately surrounded by areolar tissue containing considerable amount of fat. Outside the fatty sheath, there is the perirenal fascia. Between the two layers lies the suprarenal gland. The two layers are not fused above the suprarenal. The perirenal space is open and is in continuity with bare area of liver on the right side and with subphrenic extraperitoneal space on the left side. The gland is separated from the kidney by a septum. Right suprarenal gland. The right suprarenal gland is triangular to pyramidal in shape. It has, 1. An apex. 2. A base. The cortex is composed of 3 zones. A. The outer, zona glomerulosa, which produces mineralocorticoids that affect electrolyte and water balance of the body. B. The middle, zona fasciculata, which produces glucocorticoids. C. The inner, zona reticularis, which produces sex hormones. The medulla is composed of ChromaHin cells that secrete adrenaline and noradrenaline. It contains cells in groups with lots of capillaries. Autonomic ganglion cells are also seen. Arterial supply. Each gland is supplied by L. The superior suprarenal artery, a branch of the inferior phrenic artery. 2. The amygdala suprarenal artery, a branch of the abdominal aorta. 3. The inferior suprarenal artery, a branch of the renal artery. Venous drainage. Each gland is drained by one vein. The right suprarenal vein drains into the inferior vena cava, and the left suprarenal vein into the left renal vein. Lymphatic drainage. Lymphatics from the suprarenal glands drain into the lateral aortic nodes. Nerve supply. The suprarenal medulla has a rich nerve supply through myelinated preganglionic sympathetic fibers. The ChromaHin cells in it are considered homologous with postganglionic sympathetic neurons. Accessory suprarenal glands. These are small masses of cortical tissue often found in the areolar tissue around the main glands and sometimes in the spermatic cord, the epididymis, and the broad ligament of the uterus. Histology. Cortex. It consists of 3 zones. Outer zone is zona glomerulosa, which contains groups of columnar cells with spherical nuclei. Middle zone or zona fasciculata has cells arranged in vertical rows. Cells have lots of vacuoles in the cytoplasm. The inner zone or zona reticularis contains cells in an anastomosing network. These cells are less vacuolated. Medullae, it is composed of ChromaHin cells, arranged in small groups, surrounded by capillaries. In between these cells autonomic ganglion cells. Development of suprarenal gland. The cortex of the gland develops from mesoderm of chylomyic epithelium, while the medulla is derived from the neural crest cells, neuroectoderm. ChromaHin system is made up of cells which have an affinity for certain salt of chromic acid. Such cells are called ChromaHin cells or pheochromocytes. These are situated close to sympathetic ganglia because both of them develop from the cells of the neural crest. ChromaHin cells secrete adrenaline and noradrenaline. This system includes the following groups of cells. 1. Suprarenal medulla. 2. Paraganglia. 3. Para-aortic bodies. 4. Coccygeal body. 1. Small masses of ChromaHin cells scattered irregularly amongst ganglia of sympathetic chain, splanchnic nerves, autonomic plexuses, and may be closely related to various organs like heart, liver, kidney, ureter, prostate, epididymis, etc. Paraganglia. These are rounded nodules of ChromaHin tissue, about 2 mm in diameter, situated inside or closely related to the ganglia of the sympathetic chain. In adults they are generally represented by microscopic remnants only. Para-aortic bodies. 2 para-aortic bodies, each about 1 cm long, lie on each side of the origin of the inferior mesenteric artery. They are connected together above the artery to form an inverted horseshoe, or an H-shaped body. They develop during fetal life, attain their maximum size in the first 3 years of life, and gradually atrophy to disappear by the age of 14 years. The ChromaHin cells of the para-aortic bodies secrete noradrenaline. Other small ChromaHin bodies are found in the foetus in all parts of the prevertebral sympathetic plexuses of the abdomen and pelvis. They reach their maximum size between the 5th and 8th months of fetal life. In adults, they can be made out only in the vicinity of the coeliac and superior mesenteric arteries. Coccygeal body. Coccygeum. Also known as glomus coccygeum, it is a small oval body about 2.5 cm in diameter situated in front of the coccyx. It is closely connected to the termination of the median sacral artery and to the ganglion impar. It is made up of epithelioid cells grouped around a sinusoidal capillary. Thus it does not clearly belong to the ChromaHin system. Suprarenal gland can be demonstrated radiologically by computerized tomography. Insufficiency of cortical secretion due to atrophy or tuberculosis of the cortex results in Addison's disease. It is characterized by muscular weakness, low blood pressure, anemia, pigmentation of skin and terminal circulatory and renal failure. Excessive cortical secretion due to hyperplasia of the cortex may produce various effects. In adults, hyperglucocorticism causes Cushing syndrome, which is characterized by obesity, hirsutism, diabetes, and hypogonadism. In women, excessive androgens may cause masculinization, virilism. In men, excessive oestrogens may cause feminization and breast enlargement. In children, excessive sex hormones cause adrenogenital syndrome, cortical hyperplasia. In female foetus, excessive androgens cause female pseudohermaphroditism. In the male foetus, it causes excessive development of external genital organs. Bilateral removal of adrenal glands, adrenalectomy, is done as a treatment of some advanced and inoperable cases of disseminated carcinoma of the breast and prostate which do not respond to radiotherapy and which are considered to be dependent on hormonal control. Benign tumors of the suprarenal medulla, pheochromocytoma, cause attacks of hypertension associated with palpitation, headache, excessive sweating and pallor of skin. Suprarenal gland sustains the body during stress by its cortical and medullary hormones. Suprarenal is drained by one vein which ends in inferior vena cava on the right side and in left renal vein on the left side. Each suprarenal is supplied by 3 arteries.